Today, we will be discussing mental health and the impact it has on men in our communities. Our special guest joining us today is Dr. Wesley Willis, psychologist and nurse who specializes in behavioral issues, relationship issues, as well as trauma and PTSD. We will explore the current issues in our country today and how we as nurses can positively impact the men in our society to live their lives to the fullest.
Welcome to The Nurses Station, the official podcast of the American Association for Men in Nursing, with your host, former oil-filled roughneck to critical care extraordinaire, Michael Ward, aka Nurse Mike, and former collegiate punter who took the nursing world by storm, Blake Smith. It's time to hide the food and drinks, friends, because you're now at The Nurses Station.
Welcome back to the Nurses Station, the official AAMN podcast. My name is Blake Smith. We're here with Michael Ward, and we are so glad to be here with you today again.
What's up, guys? Yes, we are glad to be here. Man, we got a good topic today. Great topic.
Yeah, one that many of us men do not really like to talk about much, if at all, and that's mental health. Many times we as men, we don't share our feelings the way it is, let alone try to be vulnerable and express that we're really having a tough time and are trying to reach out to other individuals, whether it be other men or just healthcare professionals when we go through the healthcare system. So we're going to talk about a little bit about the numbers behind mental health, how it affects us in America. And then it's going to really just set up the great interview that we're going to have with a leading mental health expert, Dr. Wesley Willis, that will be on the podcast here later. So to start out, U.S. male population, Mike, we're about to 152 million now. And what is staggering in this news article by, I believe it is... who is this by? Mental Health America. And, this is evidence-based. I'm not as familiar with them. Maybe Dr. Willis is. But they state that there are 6 million males that are affected by depression per year. That is a staggering number.
That's crazy, man. That's wild.
1 in 5 adults experience a mental health problem each year. And they actually even say that serious mental illness costs America $193.2 billion in lost earnings per year. So people not going to work.
Lost earnings.
Yeah, or productivity. And so this is a big issue.
Yeah, man, that's crazy. When you were about to say 193.2 billion, I was thinking that's the cost within healthcare. But no. That is actually the lost earnings per year. So that doesn't even count the money that's that it costs just dealing with mental health illnesses, right? Mental illnesses. And I have to say, man, talking about my feelings, that's like my worst quality. All right. My wife. No. Yeah. Right. So that's not something my wife really loves about me, about how I can, expound on my deepest sensitivities. I cannot do that. I don't know, man. I don't know what it is. I'm just don't talk. Women can talk about their feelings, and it's admirable, right? To be able to do something, just to open up, and be vulnerable. And if you're feeling down, or if you're feeling sad, or if something, is really, really bothering you at a deep level, to be able to talk about that thing. I mean, that's like a superpower for the ladies, that men are just not equipped with.
Yeah, and you can make an argument that it's either history. We've talked about on previous podcasts of, what those reasons may be. But, it's even difficult for you and I to have these conversations, but we know we have to have them, and it's so important to have them. So that's why, we're putting ourselves out on a limb here for all of you, and hopefully we'll spur some further conversation and maybe encourage those out there to do the same. But I think I come from a perspective of it doesn't have to look exactly like how females share their feelings. I think we're put into a box sometimes of saying you got to share your feelings better. And we always think it's that touchy-feely, aspect of our feelings. I don't agree with that. I never have. I think that we can sit down, and if the environment is right and we're around those who we trust and actually have our best interests in mind, we should be able to be vulnerable as men.
Well, yeah, and I agree. And you touched on something briefly that really hit home is that we're nurses, right? And we understand, how deep this rabbit hole goes, for people who are going through this. And even knowing that, it's tough for us to share, right? To be open. So imagine all those, who are not in healthcare, that how hard it is to open up. And there was something in this article, by the way, that I saw. Let me see if I can find it. But it was about, men are less likely than women to seek help for depression, substance abuse, and stressful life events due to, stuff, right? And it even says things that they do, instead, of opening up. I can't, I don't see it right now. I'll come across it. But it's not like we don't say, hey, we're sad or we're depressed or whatever. But instead, we do stuff like, maybe we lose interest in things. We stop. Maybe we stop going and working out, or maybe we stop doing the hobbies that we enjoy doing, or that's
It's very subtle ways that I think men express
subtlety
or have symptoms of depression. And of course, we're not going to talk to you about it. So, and that actually leads, overall, what they're saying in this article, that there's 5 major mental health problems affecting men. I don't think these are exclusive. Again, I would defer to Dr. Willis when we have our conversation, but they're stating that I think the 3 that are affected by not sharing our thoughts are depression, anxiety, and even eating disorders. But then 2 others are more medically diagnosed, and those are bipolar disorder and psychosis and schizophrenia. So, but I think the biggest one, I think that affects the most, and I have had both of these. I don't think I have had medical diagnosed depression, but I've certainly had anxiety lately, not lately, but, just in the recent past. I just had my second daughter was just born, and, with all these great things that are going on, trying to be able to juggle life. And what's really awesome is that I can have those conversations with my wife and with my family, and we've been able to figure it out so that I wouldn't have these anxiety issues like I had for a little while. I had to talk with my doc about it. I'll be blatant with you. If we're in the interest of sharing feelings, let me share my feelings here with everybody. But they thought about putting me on some, medications, and being a nurse, Mike, that it's like, I don't need that. But
well, you're a guy, and
so there you go, right there. And so, but I was told by my doc, you just gotta be able to decompress, and get organized, and things will be great. And they have. There's always those common stressors of being a parent. All of us out there having, a toddler and a 1-week-old at home. You probably feel my pain. But if I didn't do those things, you can slip into depression pretty easily, and it can sneak up on you. I've had family members where, being a nurse, it's a little bit, I've been around it more, I guess. I've seen it more. And so you kind of pick up on those things. I mean, don't you, Mike? I mean,
yeah, I think, for me, I think there's little nuances that I can kind of pick up on whenever I feel like somebody's down. And sometimes I'll ask, I'm like, so how you feeling? But I won't pry, of course, right?
No.
So how you feeling? And I think it's just because we have been around it, and we kind of see how people, who are medically diagnosed as depressed, or, having depression or anxiety, I see them in the ER, man, when they come in, and it's horrible, especially when this is like a new thing for them, and they don't know what's going on. They just know that they just can't handle what's going on in life, right?
Mhm.
And so it's just rough, right? And I've been in certain situations in my life where I feel uh, like I'm anxious, right? But I feel like I've heard enough talk about things to do to help with anxiety. Um, like for me, with anxiety now, because depression is different, obviously. Depression, anxiety, because what I've noticed is the people that I know who are depressed, when they're going through this deep depressed state, they don't want to do anything, right?
Yep.
Anxiety, for me, I think is a little different because I feel like if I'm feeling a little anxious, I can go like work it off, right? Or I can go grab a coffee, grab a book, just sit and just kind of put it all aside and just get in my own little place. Or I can go to the gym and just really, really work through it. And then I come out feeling better, but depression is different, right? People get depressed and they get into these situations where they have no interest in anything at all. And they're just sad or just something is going on and they don't know why, right? My wife is really good at this. Okay, like she's not clinically depressed, but she has days, right? And she's pregnant, right? So she's 8 weeks away, and she has days where things are just a little different. And I'm like, honey, are you okay? And she's like, yeah, I'm just hormonal. She knows, and that's
Yeah.
awesome, right? Because
Well, my
I
wife
don't have to
too.
say it.
Like I'm going through the
I don't have
back
to say,
end of
you're
things.
hormonal, right?
Yeah, I'm going on the back end of things, and Melissa, my wife, she is a rock star. She's probably tougher than me, and she says that she can't handle pain and depression very well, but she's one that can handle a lot. I see it every day, and but I also can tell when something's off, And last time around with Nora, our first daughter, she, it was about two weeks, that when hormones are being readjusted, and we're still in that time frame too, but um, we always talk it out, and she doesn't get mad at me when I'm like, babe, are you all right? And, those are conversations you got to have, because if she's not all right, she knows she can tell me. And it may be a little bit better because I am a nurse, and she feels like she can share those things. But I'll tell you also, I get frustrated sometimes because when our daughter not being a baby nurse, I will tell you, I'm not an expert in that, but you know, she over an umbilical cord thing. I don't want to go on a tangent, but um, uh, Emmeline's uh, cord fell off the other day, and she's like, "Oh my gosh, there's some discharge from it. We should call the doc." And I'm like, "Babe, it's fine. Let's watch it." She goes, "How do you know what to do?" And I'm like, "What are you talking about? It's a wound. I can watch. Like, it's not any different. We'll watch it. If she develops a fever, then yeah." But but I can tell those hormones are still racing, and she knows it. And I think that's the biggest thing
Oh
for
yeah,
we as
for
men.
sure.
We need to know that too, because both of our wives, those are just great examples of they're aware, they're self-aware, they know how to reflect and think inward, and know when something's going on. We as men sometimes we're like, we're just gonna shove it down, put it in the
Yeah.
back. We're not gonna deal with it instead of confronting it with your loved ones as supporters. So, um, and that kind of goes in the next part of this article that, with depression and anxiety, if you don't get a hold of these things, one of the number one killers of men is still suicide. And society really has done nothing about this. They do research on it. They say that it's prevalent, but that's it.
Wow.
I'm not saying we have done nothing for it, but if this, and this is going to be probably a little controversial, but if this was in a women's health area, because they're so comprehensive in how we deal with women's health, and I'm so in on how we've gotten our grasp of that, we need to do that with men's health as well. And, um, and we need to address this with suicide. And I think it's probably because we as men don't share, what's going on until it's too late. And we, as men, I hate to say, are pretty dang efficient. Um, at ending our life if
Like
we want to.
suicide? Yeah. Oh yeah, for sure. Hey, let me read some of these statistics here. Can I? On
Yeah,
the
go
suicide.
for it.
Let me take some time here. So listeners, listen, you got to check this out. These are fast facts about suicide in males. The highest suicide rates in the US are found in Caucasian men over the age of 85.
Wow.
Is that wild? Um, the highest suicide rates in the US are among the elderly.
I wouldn't have thought
Wow,
that.
dude. I would never ever have thought that. That just goes to show how bad depression is in elderly
Mm-hmm.
people. You know, male suicides have been on the rise since 2000. Suicide is the seventh leading cause of death among males, accounting for 2.2% of all male deaths. Sexual orientation plays a big deal in this. Gay and bisexual men are more likely to develop mental health disorders than heterosexual men. Gay males are at an increased risk for suicide attempts, especially before the age of 25.
That one I could see a little bit more. I totally, and it's because they're unable many
Dude, that's a
times to
lot
be
of
themselves.
pressure.
It's a ton
Yes,
of pressure, and it's
lots
so
of
wrong,
pressure.
in my opinion. Let people be who they are. That's
Yeah,
my,
that's
and
a big deal.
other people might be on the other side of that argument, but that's just my opinion. I don't know why
Can
it's
you
such a big
imagine
deal.
living with a situation like that for such a long time, and there's this huge risk of being ostracized. You know what I mean?
Hmm.
For just the way that you feel. Like I feel a certain way, you feel a certain way. What if you couldn't feel the way you felt because you were worried about the way that people would respond?
Exactly.
How
Well,
hard would
actually,
that be to live?
another Blake Storytime moment. So one of my best friends in college, I won't say his name because he hasn't given, I don't want to go into
Yeah.
that detail, but we were in a fraternity and we all kind of knew something was up, and we loved him just, like a brother no matter what. And it wasn't a big deal to us, but it was to him, and it's hard to approach somebody you when they're going through those things. And he may have had some depression issues. We haven't talked all the way through that yet because he's just recently come out to us at the age of 30. But I've never seen him happier in life. And it actually happened at one of the weddings for our fraternity brothers. He can't. He finally decided, he's like, I'm just going to tell everybody. And I'm so glad he did. And I could see him when he came up to me. I'm like, what's up, man? Because he was beating around the bush about something, and him and I can have in-depth conversations about anything. And he's just like, Blake, I'm gay. And I just turned to him, I'm like, what does that change? That changes
Yeah.
nothing for me. And I'm like, I actually support you even more as my brother for you to have the courage to come and tell me that. And
Yeah, that's
and now
man,
you
it's
see
gotta
him
be so tough.
pictures, and he is who he is, and
Imagine what he was wrestling with for
yeah,
so long. And I bet you he was going through some depression big time
yeah.
through parts of his life. I would be willing to bet big money on that. But you just can't. How do you just internalize that and keep that in
Hmm.
without that having some type of detrimental effect, on the way that you feel about things, right? It's got to be tough.
And and that support system he had. I mean, because we all reacted the same, um, because we knew who he was as a person. It doesn't matter, you know, to me, what your sexual orientation and all those things are. So I guess maybe that's my perspective, but our fraternity and our pledge class, we have a wide variety of backgrounds between, being in Nebraska, we had rural and urban, and, we come from all different walks of life. And it was so cool to have all of us be there and be supportive of him. You could just see it just lift off of him.
Yeah,
And
I
it's just a
bet.
beautiful
I
thing.
bet.
So I would say support your friends if they come to you and say that, regardless of what you may personally feel, but it will help them being able to express themselves much better. The other parts are here: risk factors, factors including social isolation, substance abuse, unemployment, military-related trauma, genetic disposition, and other mood disorders put individuals at a higher risk of suicide. And that, I think, is more commonly accepted and known throughout the nursing community. What that we see, that outside influences and even genetic disposition. If you had depression in your family, um, that is something that you just puts you at a higher risk. So I think that is probably one of the more mainstream facts, don't you think, Mike?
Yeah, for sure, for sure. And I have to say, there's a couple people closely related to me, and again, I don't want to call people out, but um, and I've seen it because of it have led to one of my siblings. I think at an early age they started showing some depression symptoms, right? And I, I hate it, because you see it from the outside and you're helpless, right? Fortunately, they actually sought out some help, but obviously, apparently, according to the statistics, many people don't, and they don't know what to do. Maybe, and
Well, and this
it's a tough topic, man. It's a tough
yeah,
topic to go through because this hits
we don't want to
you know
be
how many
Debbie.
people.
And I feel as we're talking here, Mike, and everybody's like, we're usually cheery and really excited and everything, but this is a more serious topic, and we want to cover this. And we don't mean to be Debbie Downers and everything, but it's a very difficult subject to tackle. But we're going to do this type of stuff on this podcast because I think we need to have these conversations, you know, uh, as nurses, so we know how we're going to not only deal with our patients, but deal with ourselves with all the stress that's put on us, to be able to reach out if something's affecting you, between work-life balance and all those things. We have to get ahead of it so it doesn't affect our lives, so we can take care of ourselves and take care of our
Yeah.
patients
And
for
not
the
just
long
like
term.
not just that, but being on the lookout, for some
Hmm.
of these things. And Dr. Wesley, he's going to really bring it,
Yeah.
today on this podcast. And I hope that you guys all stay on. Hope you stay and listen. He's really, really going to bring the heat today about this topic, because that's his thing, man. That's his specialty, and he's got some good stuff in store for us today. Um, Anything else on this that you'd like to cover?
No, I think the only other thing is that we need to also understand that people can be very successful and still have these things going on in their lives. They just are able to, maybe not find the most healthy ways to cover it up, especially with men. You know, and I think the most frequent way is alcohol, or other substance abuses, but the one that's more socially acceptable is alcohol, and they become alcoholics over this when it's really not their drinking dependency itself. They're doing it to cover something out and running away from something because society in the past and still to this day does not let them, um, share their feelings in a acceptable way in many instances. They have to be very protective in how they, um, share their feelings. So I think that's the biggest thing. That we
Or
want to
do you remember who was it? Uh, the actor, the male actor that killed himself.
Heath
Just
Heath Ledger,
I guess no. It was after that. It was he played
Robin
in
Williams.
Jumanji.
Yeah,
Robin
Robin
Williams,
Williams.
man.
He
Who
loved
would
to
have
make
thought, man?
people
Who
laugh.
would have thought that guy was
Yeah,
battling depression?
yeah. He made other,
I'm,
and he said in his note, or the things leading up right before his death, he was saying things to his family like, "I love to, I always love making people laugh because it makes me happy." But it almost is to the point where he was trying to, it was like a call out that we were benefiting from entertainment, but it was a call out, and he didn't know how to better, reach out to people to say, I'm hurting, but I want you to not hurt like I hurt. And
what a
he
terrible,
internalized that.
terrible loss. What a
And
terrible tragedy, man.
so again, that's just an
And
example.
no,
And then you have athletes like Terry Bradshaw,
oh
Brandon
man,
Marshall, Larry Sanders, Keon, Dooling. Some of these people were before our time, but
just battling
it's
these things,
prominent.
man.
It's prominent, and it's a lot more common than we think. So I am so excited for this interview. We are going to move, we're going to actually allow more time for this, and we will be back on with Dr. Wesley Willis, uh, psychologist and nurse, to talk about these issues. We are honored to have Dr. Wesley Willis here with us today, a well-respected and prominent psychologist and nurse. He specializes in relationship issues, behavioral issues, including trauma and PTSD. Some of you may recognize him on social media as the Nurse Doc, and he doesn't know I'm going to do this, but his appearance on Good Morning America that I watched the other day at the end of March. So we welcome Dr. Wesley Willis with us today.
Thank you, guys.
Right
it's so
on.
great to be here.
Oh man, what an honor! What an honor! What a pleasure! You know what? I wish there was some way we could do like a virtual autograph. You know, where you give us a little autograph. You know, that's awesome, man. And you just got back from Thailand because you are a celebrity. Is that right? Is that how that works?
No. It's part and parcel because I believe that as nurses we work very hard, and we should definitely enjoy some of the things that that the world has to offer. So it was an opportunity for me to go and do some just time meditating and working on me.
That's awesome.
Yeah, you definitely need that, in our professions. So, we're glad you're here today, and so let's start out with, tell us a little bit about your journey. We all have a journey into this, servant leadership as nurses, and tell us a little bit about the current position you hold. Plug anything you want to plug, and kind of start us out of how you've gotten to this point in your life.
All right. So I started out as a nurse. I got my associate in a very small town. I'm from Talladega, Alabama. So I went to the community college there, and I graduated as a nurse. And it's kind of quite a while ago. I won't say the date because I don't want to date myself, but not at a time when being a male nurse was all the rage that it was. And so I didn't feel well received. So I kind of went on and did my journey and got my BSW and my MSW and moved to New York City, into a bigger metropolis where where nursing was just incredibly diverse, and it was also at a more mature time in my life. And so I got my BS and I got my doctorate in psychology. The funny thing was I was working as an emergency room nurse here in New York City when I was told that I was a little bit too slow with my patients. So I kind of realized I like talking a whole lot. And as an ER nurse, you kind of need to get the nitty gritty, what you need to know, and not pull up a chair. So I got my doctorate in psychology. So it was a pretty good transition and opportunity to kind of bridge the two together.
Well, you just wanted to know where they were coming from. You gotta sometimes know your patients a little more than just what's in the chart, right?
Exactly. I was a small country town boy, pretty new to New York City, so I wanted to know what brought you here. Tell me more.
Well, I'm sure there's some pretty interesting stories that came out of that too.
A lot of interesting stories.
So you started with the associate's degree, then went to the bachelor's degree, then the master's, then the PhD. Man, you just stair-stepped it all the way to the top.
Well,
what a ride!
I wish I was a little bit smarter, but it just happened to fall that way.
Oh man, that's awesome. That gives you a lot of perspective.
Thank you.
So let's just start out with the beginning, or let's think globally and then kind of maybe break it down into the weeds a little bit. So from your perspective, being an expert in this area, what are the current trends in mental health when it comes to men?
So men actually have increased in numbers over the last few years in terms of reaching out to service providers. So that number has kind of gone up from, I think the last poll was around, I can't remember actually the number off the top of my head, I do apologize. But the trend is really trending up. It's starting to be part of regular conversations. Just a month or so ago, I presented at a male health and wellness conference, and a huge part of the conversation and dialogue was around mental health. And there were other practitioners, none who are also nurses and psychotherapists, but the fact that there were 3 other panelists that were men practicing as individual practitioners was huge. So that number is improving. I think that it definitely hasn't met the numbers that we would like, especially considering that serious and persistent mental illness affects men disproportionately more. So those things like schizophrenia, men are more likely to have the more negative traits of schizophrenia than are women. So but yes, it's improving.
Awesome.
Wow. Well, what do you commonly see like among the men? I know you say schizophrenia, but what do you see as more often than not? Do you see more depression, or do you see more anxiety-related issues, PTSD? Or what is it?
So men suffered pretty much more in terms of depression, and the symptomology looks very different for those. For women, men are more likely to commit suicide, be successful in their suicide attempts than women, which is kind of representative of the fact that men suffer more harsher depressive symptoms internally than women. So they do suffer depression more so than women. Women have higher rates of anxiety over men, surprisingly. I think that also in terms of like the personality disorders, the rate of men is a little bit higher as well.
Gotcha. And are these with these trends and everything? And like you said, I think it's great that there's been an uptick in men reaching out, because I know that we all know as men that we don't share our feelings very, very well with each other from time to time. And you say we internalize, and I agree with that with the men that I see on the front lines in my areas of specialty. You sometimes have to pry back those layers, and like you said, I think it's great that more men are practicing, because it helps that connection. There's some connections there that they may see themselves in that person that they're trying to share their vulnerabilities with, and feel safe in an environment to do so.
Right, very much so. Men are more likely to reach out to male practitioners than female practitioners. I don't have that data, but I will say just anecdotally from my experience in terms of answering the phones when my assistant doesn't answer the phone, and getting men who I am so glad that that you're probably like the 5th person that I've called, the 5th male that I've called, and you're the only one who answered, because we're very smart. But yeah, I think that there's definitely some benefit out there. I mean, there's documentation anyways to the things like how when practitioners look like them and talk like them. And so I think that I definitely feel like that translates into men being men and having conversations with men, that their experience is better, and that their symptoms improve more so.
Do you see a correlation, between, men internalizing their feelings and or just thoughts, and the correlation of men not accessing healthcare in general?
I like to, when I have couples come into my practice, one of the first books that I kind of already can surmise that they kind of need to add to their repertoire is Men Are From Mars, Women Are From Venus.
Yeah.
And I don't know if you guys ever had the chance to read it.
I have. It's been a long time, but I definitely have read it in the past.
Okay, so then, as part of the book, it definitely has real life issues and conversations about how men internalize and deal with kind of like real conversations, and how we deal with kind of like things in our head versus our female counterparts want to have conversations about it. They want to understand it more. So yeah, that's one of my books that I have right on the coffee table when patients come in, and men are from Mars and women are from Venus. And I still feel like it has some relevance today.
I have to say, man. So, and by the way, I do have that book, I believe, but I have yet to read it.
With all that leisure reading time you got, Mike.
I'm gonna read it. I promise. You know what I see in the ER a lot is, younger men, and I say younger. Okay, so I'm 41, and I consider myself a young man. All right, but I don't see a lot of men coming into the emergency room whenever we're looking at their meds, and recording their meds. There's not a lot of men who take antidepressants until they reach a certain age. I feel like maybe in their late 50s, early 60s, then you start seeing these men come in and they actually have something, some type of antidepressant that they're taking. Is that because men are diagnosed later, or men just are willing to talk about it more the older they get? What do you think?
I think that there are a couple of things. I think that I would say, just from even having this conversation with educated men being nurses, and saying, hey, I think that you could benefit from an antidepressant. And the first thing they say is, I'm not willing to take antidepressants because I don't want to deal with erectile dysfunction.
Yeah.
And that's just a real, true concern about young men and the medications they take. We're at that age, and I consider myself young like you, Mike. And we want to be able to have a full life, and so I think that's part of it. And I think that the other part of it is that men want to more so deal with whatever it is in the way of psychotherapy versus taking medication.
So and I completely agree with that. And so with that not being on the table, because for a lot of men, you can talk to your blue in the face about how important it is, especially in some certain cases, for them to do so when appropriate. What are there alternatives that, men listening today, or we as nurses that are listening to this podcast, can maybe help them with? It may not be pharmacological in nature, to kind of help express themselves in what they see as a manly way or a masculine way, yet but still be productive to kind of avoid the snowball of depression that many times leads to suicide.
Right. I think men value tools more. As a cognitive behavioral therapist, one big hallmark of cognitive behavioral therapy is patients are required and expected to do homework. And I find that my men in therapy are excited to actually have tools, and sometimes we'll take that tool and actually put it in practice more so than my female patients. They'll pull out that worksheet, or they'll quickly call it like an emotional timeout. So I think that tools is a great thing for men in terms of, because they have something they can feel like they can use, versus kind of like the soft skill of let's have these long, flowery, drawn out conversations.
I believe that.
Well, yeah, and I think that is, bringing that up, it's, Mike, from past podcasts and just from conversations about male caregivers as well, I think there's such a trend to that in regards to they're more action oriented, they're more work oriented focused, where give me something to do, what are the tools for me to be successful, and then they come back to you and say, hey, did I do a good job, did I complete the mission? That's where I kind of see this trend going.
Yeah, that's very much me.
Exactly, and it's a lot of men actually.
So that's one aspect of how men deal with their depression and everything. And while we have you on the air, I know that there's an elephant in the room, and I want an expert's opinion on this for all of us nurses out there. Right now, current society is really trying, or some of society is really trying to push the correlation between men and mental health when it comes to the expression of violence. And my first question is, from your perspective, in your expert opinion, is that a true correlation? And if so, what are some suggestions that we need to do as healthcare providers to help identify things to help these men avoid getting in these traps and going down that road of that mental health issue?
Yeah, Blake, there is definitely, unfortunately and sadly, a true correlation in men who are experiencing mental health symptoms and mental health diagnosis, and their decisions to carry out violence and like harm others versus our female counterparts deal with their depressive symptoms quite a bit differently. So in terms of like things that I think that men or like any person as a caregiver or family member can do is look out for like signs of isolation from like their family member or from like or your patient that may come into the ER. Say the patient is a male, you see him regularly, and we'll be honest, those of us who worked in the ER, we have our frequent flyers, our guys who are females who come in and say, I just don't feel right, and the doc says, hey, you know, there's really nothing medically wrong with you. Kind of delve a little deeper. What is your what is that person's connections? Who are they connected to? How do they deal with their frustration? Do they have anybody that they talk to? Not necessarily a therapist, but who do they feel like they can go and have a conversation with that won't judge them? I think that's one of the biggest things that I've used in terms of working in the hospital setting and out of the hospital setting to identify and kind of like reach out to the guy and say, hey, are you experiencing things like, lead that into say, are you experiencing things like, crying or feeling sad or feeling the blue? Are you finding that you don't enjoy doing the things that you used to do, like going to the gym or connecting with friends or whatever they used to do, and now for whatever reason they no longer do, and why?
That's a good point. And so many people are using the emergency room these days, as their primary care, right? And the problem is that whenever you go to the emergency room, as you stated, there's no time, right? So the ER doctor or the nurse practitioner or PA, they go in with, guns blazing. They're in a hurry. They want to get to the root of the cause. And if it's not medical, then it's kind of like, well, you're going to have to go talk to somebody else, because, obviously this isn't something that we can take care of today. So it's a tough situation, right, for a lot of people, because maybe they are at their wit's end and they're trying to, reach out for help. And so the first place they know to go is the emergency room.
Right.
And, it ends up maybe not being the most optimal, the most optimal end to what they were hoping for whenever they go. And, that becomes, I believe, problematic. And you said something a while ago, someone that they can talk to, whenever somebody's looking, do they have somebody that they can talk to? That kind of reminds me of something that I heard about, the stigmatization of mental health issues, right? And does that play a big part in this? Like, because I know that some people, especially guys, they just don't want to talk about it, and I think it has something to do with a lot of people, they look at mental health as, like somebody with a second head coming off the side. You know what I mean?
Yeah, and I think that's so, and I completely agree with that. But I think what we're stuck in this mud. I think, in my opinion, in regard to, we're easy to scapegoat mental health on whenever one of these tragic events happen due to violence from a male. But yet then we, if it doesn't happen to us or we haven't seen it ourselves, you're like, oh, it's easy. We'll just brand it as that, but we take no action. And we create the stigma instead of having a in-depth conversation that's productive to help these individuals. And I almost come to where I will say, having two daughters and everything, I watch the Disney Channel a lot, and I'm so excited in regards to what society has been doing to empower women, and I agree with everything that we're doing for women and need to continue to do so. But I think where what I've kind of then started reflecting and noticing is like, where are we in bringing our young men and bringing them up correctly, and showing them that they need to express their feelings in a in a productive way, and we could be doing the same type of campaigns but maybe in a different direction, so that we don't lose a generation, which I feel in some regards could have with those that may be in the teens or younger 20s. I didn't know what your perspective was that on Dr. Willis.
I mean, I think that I feel like I'm a part of that generation. Like I said, I grew up in a very small town, Talladega, Alabama, and I remember my senior year, or maybe my junior year, that we had an act of violence where a younger male in the school was being teased and taunted by an older male, and he made the decision to go home and get a gun and bring it back to the school and shoot him in the parking lot. And this is, again, a very small town. And kind of like what had come out of that conversation was this, our classmate had felt like nobody came to his rescue, and that nobody was there to help him while he was being teased and taunted. And this is all he had as an option to do, because he had come to the end of the road with this, dealing with this issue. I think that, so then I still consider myself a part of that generation that still has men struggling with, how do I reach out, or how do I deal with this in a different way? I think that how we can do that is those of us who are men is starting the conversation, not just starting the conversation, continuing and supporting those things that happen in the conversation. Like I said, being a part of this men's wellness health conference that will happen like 2 weeks ago here in New York City. I think it's sad that they should be stating this is their first annual in 2018, and this has been going on for so long. I think that we just have to kind of push through kind of the minutia, I guess you can say, of like low turnout, and say that, you know what, if I can just help one person, then I've done exactly what I'm here to do.
That's good.
Yeah, so well said. And I agree with we need to continue and actually have some action. And I think that's where we as professional caregivers, we need to start standing, first of all, side by side with our female colleagues in our profession, and empower them, but also empower the men in our society, and become more public in our image of creating this counter narrative to this, rampant bullying and assault that's just kind of all over the place on a daily basis, to show that that's not what a true man is. A true man is one that stands with integrity and principle and protects when they need to protect, but they don't protect just themselves. They protect the vulnerable, based off that integrity and principle, without violence. And that's where in my opinion, we need to continue to go. And I think that you're doing a great job in that area, Dr. Willis, and AAMN is started down that road, which we should have done a long time ago. But I think I like the conversation we're having, and I hope that this conversation sparks more conversations from those who listen to this podcast, to make it more of a trend, and so we can continue to expand this narrative.
Do you have any?
I agree.
I'm sorry.
No.
Hey, do you have any? Say, as as healthcare, as nurses, we come into contact with these people. Do you have any recommendation? Are there any tools that you would recommend that we as nurses, we need to really internalize? We need to have these down, so that when we see something, we recognize that something may be going on in this person's life, that we can go over. We can not quiz them, but kind of go through these things. I know of a couple, but I want to know what your thoughts are on that.
Well, just like I think it's been a few years now when we had the real big national push to put suicidality screening in our emergency room documentation. And everybody who comes into the emergency room now, the question is, do you want to harm yourself, or do you want to harm anybody else?
Yep.
And I think if we add just that the very same kind of like urgency and importance to our documentation and to our own accountability, the question of who who do you live with, who do you talk to, how do you deal with problems, as opposed to kind of just running through it in our assessment. I know,
Yeah, it's kind of like check.
Exactly. But I every time I do an admission, I ask that suicidality question. Do you feel like hurting yourself, or do you feel like hurting anybody else? And then that right there triggers another thing. So I think that, honestly, when you ask people or ask God or ask me, they'll be honest. I don't talk to anybody. They will tell you. They won't sit and try to sugarcoat it. So I think crafting out questions that show that you're concerned versus that you're just trying to, get through your assessment is an important piece of what we could possibly start doing.
Nice. Well said.
Well, thank you so much for being here, Dr. Willis. And before we go, I know you got some things to plug. So this is the time that we would love for you to plug. And we set aside quite a bit of time because we know how active you are. so you go for it.
Well, like I said, I love the work that you guys are doing over at AAMN. I was a member and have been I know so many people who do really incredible work over there with you guys over the last several years. And I think it's made me a better practitioner. So being the nurse, what I call the nurse doc, is a culmination of experiences that I've had both as a member of AAMN and just being a nurse in general. So I definitely would love everybody to check out my blogs that I'm doing, because I think that relationships are so important and significant, not just relationships with our spouses, but relationships with ourselves. As caregivers, as non-caregivers, we kind of have to get back to ourselves and taking care of ourselves. It's really shocking and amazing, I think, in 2018 that we've gotten away from that message. So yeah, check me out, check out my blog. So thank you guys for having me on.
All right, and we're going to go ahead and we're going to put a link to both of those. Well, so what social media are you on? I know you're on Twitter because we're on Twitter together. We connected on Twitter. You're on IG. Yeah. I know that because we connected on IG. So what else? What else you got going on?
Yep, I'm on the nurse. I'm on Facebook as the Nurse Doc, and I also my webpage www.thenursedoc. So that's all one word. .com is how people can go and they can see videos, podcasts that I've done. Also, my patients typically go there to schedule their appointments because I do teletherapy. So I don't 100% of the time go into the office. I see a lot of patients virtually through telemental health and telepsychiatry.
That is great.
I know. I can't tell you how amazing it's been. So I provide teletherapy to people all across the United States via end-to-end encrypted HIPAA-compliant platform. And it's really, 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 I think, transformed and not just helped my practice, but also help people who wouldn't otherwise have a practitioner in their back door that they could go to, and that's convenient.
Right. That is great. And that's really good to know, because sometimes, I'll be in the emergency room and I'll have a patient, and maybe they,
I know exactly
somebody
who
to
you
go.
need
They
to
need
see.
somebody to talk to. I'm like, hey, I got a guy. Hang on.
I got a guy.
Let me get you his information.
Exactly.
That's awesome, man. Because some people, hey, they don't want to leave the house. Maybe they just don't want to get out around people.
They feel more comfortable maybe at home.
Yeah, what a great service.
Mm-hmm.
Well, and it's so funny. I got a new patient recently who is traveling across the country and doing some really actually important work as in terms of for mental health. And so he recognizes on his own, like, hey, I need to stay connected to someone. But he's working not just, in one state. He's driving from New York to Georgia to California to Oregon and hey, it's great to be that resource for him. And I think that there are so many other people who live such incredibly busy lives, trying to take care of family and take care of others. That this is really kind of like the way that mental health and telepsychiatry is going.
Man,
you can lay on your own couch, get one of your own couches, right? Instead of
Exactly.
Well, thank you so much for being here. Again, this is Dr. Wesley Willis, a very accomplished psychologist and nurse, we are very proud to say, doing great work across the country and the world through telehealth medicine and mental health.
All right, guys. So that was that. And, we just want to let you guys know about some upcoming things we have going on. First of all, as many of you know, or many of you might not know, we actually have a Nurses Week, and that's coming up in May. And so I want you guys to know that we have got some good things going on. We're actually going to be running a campaign on IG, and what we want to do is showcase all the male nurses out there. So what we're going to end up doing is I'm going to reach out to you guys on our personal Facebook page. I'm going to be posting on IG, on Twitter. You guys, I want some posts. I want some pictures of you guys. I want some stories because I want to highlight you as male caregivers in the nursing role, and we're going to just showcase that. We're going to showcase you all month long. Every day, I'm going to post a picture or pictures of male nurses just living life, right? So if you wouldn't mind, guys, send it in to us.
Living life large.
Living large, baby. And so we're going to highlight you guys. I'm excited. I'm excited about it. So let's go ahead and get that going. And you guys can start that at any time. And you can find us on IG. You can find us on Twitter below in the description. All right. And then if you would, you can just DM us, personal messages. If you're on our Facebook group, you can just kind of reach out to us that way. Easy. And I look forward to getting that. You want to add anything to that, Blake?
No, just that we know that all nurses are just as important on Nurses Month and I like it to be Nurses Month, not just Nurses Week. But I think we as AAMN, we need to showcase the male nurse as well. We love our female colleagues as well, and we want to make that very clear. But we as AAMN want to show the faces that nursing is not just a traditional female nurse. It is also about men. So we hope that our female colleagues celebrate with us and post everything that they want to post, and we are right behind them. But we want to highlight the male nurse as well, and that's what we're going to do with our IG account. So I just want to make that very clear disclaimer.
Well said.
I love our female colleagues. I could not do this job without them.
Yeah, exactly. This is the AAMN, right? But we got like 30% of our members are female.
Yes.
Is that right?
Yes. And
we have females who are on the regional committees.
Yeah.
We're a team, baby. There's no I in team. There's no MEN in team. You know what I'm saying?
There's no G in team either. I don't know. There's a lot of letters not.
Yeah, that's true. That's true. There's a lot of letters that aren't in team. Okay. All right.
So
anyway, all right.
I'm going to plug our next two episodes. So obviously, May 7th being the Monday of Nurses Week, we are going to do a special podcast all about nurses, talk about where we've come as nurses, where we're going in the future, and who would we love to hear from again, Mike, that could talk.
Oh, dude, I'll tell you, this is like a no-brainer, right? Brent McWilliams, Dr. Brent McWilliams, that's the dude, because I know he's going to bring it, man. Not only does he bring a lot of knowledge, he brings the heat, man. He brings the energy. He fires me up when I'm talking to this guy.
Yeah, every time. That guy, if he would have talked to me, I would have went into nursing school, but someone else beat him to the punch. So, we previously talked about Eric Williams, Dr. Eric Williams coming on the podcast. He would absolutely love to be here for Nurses Week, but unfortunately his schedule is not working out to record prior to Nurses Week. So I just want to mention that for those that were looking forward to Dr. Williams being with us, do not fret. He said that he would love to be on the podcast. It's just the timing is not working out. So we are going to get him on the podcast very, very soon. And he's very excited. And I'm very excited as well to have him be with us in the near future. Now,
me too. He told me, he said, listen, I want to be there. He said, but man, I'm busier than a one-handed bricklayer with crabs. And I'm like, what is that? What does that mean? Anyway, so and then he's. I'm just kidding.
I don't think he said that. I don't think he said that. But anyway, but speaking of our female colleagues, being a more serious note, we as professional caregivers, being male nurses, we don't only take care of men, we take care of females too, right? Am I right, Mike? You know,
yeah, absolutely.
We don't just take care of men, and
they take care of us.
Yeah, and they take care of us. So the week of May 14th, it's actually Women's Health Month, and so we were thinking, what can we do to highlight Women's Health Week, because we think it's a very special week. It's a very important week, and so we're having a researcher by the name of Marcy Cottingham. I had to think a little bit. I'm like, man, she's done so many things. How do I classify her? Because she's done so much stuff. But she's a researcher on gender studies, and she's done a lot of work on gender studies within the nursing profession. And she actually is international. She lives in Amsterdam. So we are going to be coming to you via two sides of the Atlantic Ocean on that week. When we do an interview with her, she is so influential in how nurses think and how they take care of people. And we are going to ask her ideas of how we as male nurses can better take care of our female patients. And so we get better as professional caregivers, and we can help our female colleagues by understanding how to take care of our female patients better. So I'm actually extremely excited about that week.
That's a good one, man.
And she is so influential. She's internationally known. She's a leading researcher in this area of study. So we are bringing her to you all the way from Amsterdam. I'm so glad that she has told us that she's willing to do this. Please stay tuned. And I'm at a loss for words here, Mike. Can you tell? Dude,
I get it. I get it, man. We're getting some rock stars on the podcast.
Yeah, it might be my baby brain. Yeah, it might be my baby brain too, because many of you know I just had my second daughter, and I'm like, I don't even know if it's day or night right now, but I'm trying to hang in there.
Dude, I'm going to follow in your footsteps really soon.
I know.
Really soon.
You've got 5 boys, man.
Well, I have one on the way, so that's the one, right? That's I mean, I hear that you just let them cry. You know what I'm saying? Just let them cry. They're not gonna. Nothing's gonna happen.
They're building their lung capacity.
Exactly.
But anyway, we're regressing here. So
we are digressing.
We love that you tune in every single week. Please keep in touch with us. Send your pics to Mike and I via our Facebook group or IG or Twitter. Again, we are so serious. We want to get the image of male nursing out there, and this is the way we do it. Let's celebrate Nurses Week. Let's learn from our female colleagues and female researchers on how to better take care of our female patients, and we will see you again on the Nurses Station.
Thanks for listening to the Nurses Station. For more exclusive content, visit us on Twitter at AAMN_nursing and Instagram at AAMN.nursing. And make sure to follow.